I am still waiting for my test results. Hello everybody, it's Mike, the Baldadonis. Boom! If you're new to this channel, hello everybody. My name is Mike, the Baldadonis, and I talk about many different topics, such as these. Now on tonight's video, I'm talking about what was it like to have a vein removed from your leg. It started way back in history. Okay, it actually started back about 4 years ago. In my left leg, I ended up getting a blood clot. Now having a blood clot is very scary. I talked about that on one of my videos, and 4 years later, well, okay, let's go back. 4 years ago, had a blood clot, did all the medications, the injections, I talk about that. But I had the vein removed because there was a varicose vein that was always giving me a problem with pain. So my doctor's office was able to go in, remove it, and then the part that was the varicose vein, the real nasty vein, they went in with a little tiny hook and peeled it out. Whoa. At that time, my right leg, I can feel a little pain in the right leg. I can see a vein coming through the skin in my lower right calf. I knew this was going to be problematic later on, but I was wearing, and I still do wear, compression stockings. Now, compression stockings are fantastic. They don't look nothing like they used to when it was just those tan looking things that your grandmother or your great grandfather used to wear. Today, everybody wears them. They're very sporty looking, they're very functional, they're fantastic for your body. I wear them today and I love them. But I started getting more and more pain in the right leg. Now, I wasn't sure exactly why I was getting these problems. So when I had the procedure done, I was talking to the doctor. And one of the things was, I am an ex-bodybuilder. Right now, I weigh around 205-ish. I managed to get up to 296 pounds from doing steroids. And I talk about that in previous videos. You can watch those videos as well. In my case, as a bodybuilder, my muscle kept growing bigger and bigger and bigger. Therefore, the veins in my body had to grow bigger to supply the blood. Okay, so once that was starting to shrink back down, so wasn't the vein. The vein started shrinking back down and get loose. Therefore, the blood wasn't circulating properly. It's a very simple thing to do, but it's inconvenient in a few ways. Now, you go in, call the doctor, well, I should say you call the doctor, you go in, have an ultrasound done in your leg. Not a big deal. Sit in traffic, go to the office, they do the ultrasound, come back, in whenever the appointment is. Usually it's right afterwards, but in my case it was not. I had to go back, therefore I had to go back to Boston, go back to the office, sit in traffic, and for him to sit there for 5 or 7 minutes saying, yep, we can do a procedure, would you like to do it? I said, let me think about it. So I was there for 5 to 7 minutes, I left, sat in traffic, go home, blah, blah, blah. So I finally made up my mind. I said, all right, let's get this thing done. It's a pretty easy procedure. So I go back, get an ultrasound again. Two days later, I go back in for the procedure, back to Boston. My undies, pair of socks, gown. Now I had a fantastic doctor. You're gonna hear him and tell you guys exactly why he did this procedure.
Todd Lancaster, vascular surgery.
All right. So why am I here today, Dr. Lancaster?
So you came in complaining of some cramping and discomfort in your leg that after some testing we found was related to one of the veins in your leg not working properly. The saphenous vein is a vein that goes from the inside of your ankle all the way up your calf and thigh to your groin. And there's valves inside that vein that keep the blood moving in the correct direction back up to your heart. But those valves had given out in your case, and so treatment needed to be done.
And what's the treatment consist of?
So initially the treatment consisted of compression therapy, which you had been doing with a compression stocking, and we elected in your case to move on to a surgical procedure. In this case it was called a radiofrequency ablation of the vein. That involves putting an IV in the vein somewhere around the calf area, and then through the IV we put a catheter inside the vein from that access spot all the way up to the top where your groin is. And then we numb the vein on all sides from top to bottom, and then once that's done the catheter is turned on. It gets very hot, and essentially the way to think about it is that it cauterizes the vein shut. The problem with this particular anatomy is that blood, because the valves don't work, the blood is going the wrong way in the vein, gravity's pulling it down to the floor, and that causes symptoms. And we don't have a way to make the vein work correctly, but what we can do is stop the blood from going backwards by shutting the vein down.
Excellent. Why would somebody like myself get this type of issue?
Usually it's genetic. People who have, the biggest risk factors are having a parent with varicose veins, having ever been pregnant, which I suspect you have not been, and then just kind of these jobs where you're on your feet all the time. Other people, like people who do bodybuilding, are a little bit more at risk because it increases your venous pressure while you're exerting yourself. But the biggest risk factor by far is family history.
All right, family history. Now, how about people that drive a lot for a living, like sitting way too much?
Yeah, well, sitting and standing in one place is bad for your veins no matter what, because you're always using those valves in the vein to sort of keep the blood from falling to the floor, and those valves can get overtaxed. So those are, sitting still is just as bad as standing still. The classic thing that we hear about with people who drive a lot is they get blood clots. This is a whole different problem, but the physiology is sort of the same.
Okay, because I had a blood clot in my left leg, and I think that was due because of a motorcycle accident, and maybe because I drove too much. It's been years. It's been years. But my last question would be: now, I was an ex-bodybuilder. I was, at the moment, I think I weigh around 205. I was 296. So, developing a lot of muscle tissue, will that grow veins and will that shrink them down so you actually have problems?
It's not necessarily that it grows veins. I mean, it's sort of yes and no, right? When you're super muscular and very active, your cardiac output gets higher, and so there's more blood pumping through your body, or pumping through at a higher volume per minute. And so, you know, the bodybuilders that have veins everywhere, we all have those veins. There's just not enough blood being pumped through them to make them enlarge.
Gotcha.
And so it's not that you're making new veins, but veins that are there are enlarging over time.
Okay. And then as we get older, will they collapse a little bit, or?
If you start to use them less, yeah, they'll start to go back to normal size. Once they become varicose or sort of abnormal, they won't. Once they're like that, that's how they are until they're treated.
Okay. Sit in traffic, go back home. My procedure was done on a Friday. So then I have to go back on Monday, back to a different office in Stoneham, Mass. To have another ultrasound done. So 3 trips for one procedure. And the procedure was actually very easy. And talking to this doctor, he was very funny. I enjoyed him. You know, as I'm sitting and talking to this doctor, I asked him if I can film it for YouTube and put it on my channel. He said, "Oh man, hold on." Goes ask some people at the office, and as I'm laying on the table ready for my procedure, he came back and said, "We can't do it, but if you come back in 2 weeks, it should be approved. I just don't want my face involved. It would be cool to see my hands doing the work." Now, as you guys just heard, 3 visits already. I had to go get medicine, put in my system, to like an antibiotic or something, so there would be any issues. I didn't want to go through any more inconveniences, and I said, you know what, let's just get it over with. But the doctor was way cool. I asked him where he was from,
Tennessee,
because most people that go to Boston hospitals aren't from Boston. The girls were great. They were funny. They wanted to be on the videos, and I want to thank them very much. I also want to thank the woman in Stoneham that she also did my ultrasound. So after the procedure, you have to wear a long compression stocking. Not a big deal. It's super comfortable. You barely know what's on you. The problem is it's a mild pain. And as you're sleeping at night, that's when you really feel it. So you don't sleep that well. I would rate this pain probably around a solid 4. It's been 2 weeks. I've been waiting for the results to come back on my on my emails through the office. And of course, I've been waiting, so I'm not getting them. Otherwise, they would probably have been up there 2 weeks ago. But the main thing is the office notified me as soon as possible, saying everything was fine. Now I just have to wait for the pain to go away because it's still painful, and the pain feels like a pulled muscle, and it's very annoying. It is getting better slowly as the timing of this type of procedure to heal is, I'm not sure. I didn't even ask the doctor that. I just knew from experience on the left leg, it took probably a few months to not feel that pain anymore. So that's what's probably gonna happen to the right leg. It's gonna take some time. If you have varicose veins, if you have pain in your legs, today's technology, they go right in and you're out in an hour. It's an easy procedure, very easy. So if you have considerations of doing that, please do so. You're gonna feel much better. You get rid of the ugly veins out of your legs. You will feel much better as soon as it does heal. I promise you that. But it does linger for a little while. It is a little, it just feels like a pulled muscle. That's what the feeling is. So that's it for tonight's video. I'm sorry that I didn't post it up earlier. I've been waiting so I can actually show the results. But after making a phone call, they said that you might not see the images, but you will get a report. You know, I'd rather show images than just a report. So I did not get that, therefore you're getting this video. All right, guys. So until the next video, Baldadonis out.